Sleep apnea is one of the least familiar sleep disorders, and though few people know of sleep apnea, tens of millions of people suffer from it. Stacey Galandi on a disorder that makes a restful night's sleep an impossibility.
At first glance, Gail, a mother and a student, seems like an energetic woman on the go. But underneath her smile, Gail is hiding a secret.
I come home and I just want to go lay down because I'm just exhausted. I wish I could sleep for a week. That's how I feel.
And she's not alone. Gail and an estimated 40 million other Americans don't get a full night of rest because of a disease called sleep apnea. It occurs when the airway is blocked. Gail's sleep apnea is the worst kind and could be life-threatening. When Gail sleeps, gravity pulls her tongue down into her breathing tube. The brain realizes Gail is getting no oxygen and jerks her back into consciousness.
When I fall asleep, my tongue literally collapses and it blocks my airway.
So by fixing that, could that fix the problem?
That could fix a lot of problems that I have.
But fix it how? To find out what's really going on when the lights are out, Gail went to the Moonlight Sleep Labs in Encino, California.
These are also to help us identify REM.
The nurses wrap Gail with wires and electrodes that will measure her sleep patterns.
Sweet dreams.
As Gail sleeps, infrared cameras keep an eye on her. The squiggly lines deliver the startling diagnosis.
She was actually waking up over 30 times an hour. Although she may have been in bed for 8 to 10 hours, she was essentially getting 2 hours of sleep night after night.
Gail has decided the only way she can go to sleep is to go under the knife.
I'm very happy because I want to breathe. I want to live.
Gail is excited as the nurses at Northridge Hospital in Los Angeles prepare her for surgery. Plastic surgeon Marc Kerner and oral surgeon Robert Hale have developed a new technique they say cures sleep apnea.
What we're going to attempt to do is enlarge that airway space and tighten that airway space.
This is actually the snoring part of the operation.
First, Dr. Kerner burns excess tissue on the back of Gail's tongue. Then Dr. Hale adjusts Gail's jawbone to make room for her tongue to move forward. The doctors say this surgery could make Gail's airway twice as large. Will the surgery work?
Hi, Gail.
It's 10 days later, and Gail says she's dreaming again.
I don't think I've dreamed for 5 years.
Good for her. Though sleep apnea most often affects males over 40, it can strike anyone at any age, even children.